the coming year.
But did you know, according to new research, that 77% of Brits are unaware that losing weight can reduce the risk of fertility problems and type 2 diabetes as well? And only 14% of people know that weight loss can benefit menopausal symptoms. All of these things are connected, you see.
Yeah, absolutely. Well, there's so many health benefits. Someone that knows a little bit more about this topic is nutritionist at the One Diet, Mark Gilbert. So, Mark, why don't more people know about this?
Well, it's tough to say. People generally know that, especially if they're overweight, obviously, losing weight benefits the health in many ways. Some of the tests your doctors do on you, for, cholesterol, triglycerides, diabetes, blood sugar control, all these things get better with weight loss if you're overweight or if you have a sedentary lifestyle, you don't exercise a lot. So but there's all, I mean, I've spent my life studying health and nutrition, etc., and how it affects the body, and it's not surprising because it's such a big field that people don't know all the details.
I mean, so many physical benefits, as you described, but also you can imagine mental benefits as well if you start to lose weight.
Yeah, every year we do this Weight of the Nation report because people are gearing up to get healthy after they've probably done a little bit of damage to their health maybe over the holidays. And one thing that came across was that 38% of people thought that being overweight was affecting their mental health. Yeah, so that is a concern for a lot of people.
So I've always been an advocate for saying we should really push people to be active because that sends off a trigger effect. With weight loss comes not only physical benefits, but of course, mental health benefits. What do you think is the key thing in mental health for this?
Well, I looked into this because whenever we get the responses to our survey, it's 2,000 people, 2,000 regular Brits, and I looked into this, and the most obvious answers seem to be the background inflammation that happens when people aren't as healthy as they could be. So if your lifestyle, if you're not active enough, if you're gaining weight, if your diet's not that great, you're going to have a level of background inflammation that it's not the kind of inflammation that if you've got a terrible injury, but it's higher than it should be in general. And as that inflammation is higher throughout your life, it's causing some damage, and it's reflecting the fact that your metabolism isn't optimal. And most people probably know if you exercise more, if you have a good diet, your metabolism works a lot better than if your lifestyle is otherwise.
Thank you, Mark. Really good to get your thoughts on that. Well, let's bring in someone who's got personal experience with tackling weight loss. Her name is Deborah Adams, and I believe, Deborah, a very good morning to you, that you have lost an incredible, well, at least 8 stone. Massive congratulations to you. Tell us a little bit about your journey.
Okay, so I first stumbled across the one-to-one diet when I was getting married, and I wanted to drop a dress size for my wedding. And I saw someone and they were losing weight. So I did it for 12 weeks and I lost 3.5 stones. So I knew about the plan. At the wedding, funnily enough, as I was dancing on the dance floor to Peter Andre's and Brian Knight's song, next minute I'm pregnant, okay? Yeah, the rest of my life, and next minute I'm pregnant, okay?
That. That's why it was written.
Okay, right. So I then became pregnant, and it was a really complicated pregnancy. And I had a blood clot in the lung, and I spent most of the time in hospital. And during that period, I gained 8 stones. I, had a blood clot in the lung. I had to be resuscitated. And when they brought me out of intensive care and weighed me, the doctor said to me at that time, if you don't get that weight off, you're going to have a heart attack within the next 7 years.
Jeez.
And it's just like, we look at weight as like and how you're going to feel, but now it was like this is my life. I've got everything to live for. But because I'd heard about the plan, I jumped straight back on it. I found myself a coach. This is the difference. I found myself a coach that was going to work with me, and I started the program. And I did a bit of a combination of meal replacements and a 200-calorie meal. And I lost on average, 6.35 stone kg a month. At my heaviest, when we talk about, you touched on mental health, you go from feeling glamorous on your wedding day. I didn't even recognize myself in the mirror. So confidence was gone. You know, I had social anxiety. You know, people want to come, they want to take pictures of the baby. I don't have any photos with my son whatsoever because, you know, I just felt like my clothes didn't fit. You know, my wedding ring didn't fit. So I just knew that, you know, I had a very big why. I needed help and support, which is what I got. And yeah, my life has completely changed to the point where, you know, not only did I lose that weight, but I actually became a consultant myself and now help and support people to do exactly the same.
Can you just explain what the one-to-one diet is, just for people who don't know?
Okay, so there are several steps. We have meal replacements, so you've got your soups, you've got your porridges, you've got your shakes. Within the and you've got like some pasta dishes. I did a combination. So I did like a nutritious shake for breakfast. I had a soup at lunch and like a chocolate bar in the afternoon. And then I prepared myself my own meal in the evenings of protein and vegetables. So my chicken, my prawns, my eggs, salad and veg. So I put my body into what we call ketosis, which is maximum fat burning mode. And I stayed there for the whole time, appetite suppressed, felt amazing. And as the weight began to fall off, you know, stone by stone, you know, you start to get back into your clothing again. I was back in the high street because at my heaviest, I couldn't shop in the high street, you know, I didn't want to go in the changing room and try on clothes or any of that anymore. So as I began to transform, my confidence came back and I just began screaming and telling everybody, look, there is help and support because when you are at your heaviest, I was an emotional eater. When you're at your heaviest, you don't know where to go. And whilst the doctors and the medical teams were saying to me, you need to do this, there isn't a lot of help and support out there for people that are food addicts or, you know, morbidly obese. So I found this program, and that is where you do get that one-to-one support of a consultant there every day, supporting me, cheering me on every stone of the way, which is what I do now. And we do it with great success.
Well,
so, yeah.
You certainly do, Deborah. You look absolutely incredible.
And more importantly, you feel incredible. So that's amazing.
And the confidence is back. Thank you so much for joining us. Really, really good to see you. And do stay with us. Lots